Good afternoon. It's my pleasure to be here. I've been asked to talk about the startup ecosystem and especially how it relates to the audience here, which is largely hospitals. Um, and I think it's important to get some perspective. First of all, what is happening in the startup world? Why is it happening? How is it materially going to change the lives for all of us here, especially providers of healthcare? And lastly, what can one do about that? How does one engage or ignore or deal with it? So what's going on? The first part I would like to talk about is our lives as individuals and the lives of the patients or consumers we deal with are changing very, very rapidly. And sometimes it's hard to reconcile with the rate at which the change is happening. If I were to share some numbers, just last 12 months on my platform, 1MG, we had 92 million unique people engage. And that's 9.5 crore is 8-9% of the country. The way people are engaging, the way they are online, the amount of time they are spending looking for all kinds of things, and we do it as consumers. We are all over, our mobiles are on all the time, we are engaging, our lives are becoming more and more digital, and very often as practitioners, we don't realize that our consumers' interaction medium has changed, or our own medium of communication as consumers has changed so much. So yes, a lot of activity is happening online, and businesses have actually not yet figured out how to deal with the changed model of the consumer interaction. Now, secondly, what is happening in the world of hospitals as it relates to the impact of technology, and what are the startups kind of helping do in this journey? So a very important thing is happening is the hospital of the future will actually look very different from the hospitals that we have been used to. And that change will happen probably faster than many of us realize or recognize. And that's the nature of how technology works. The hospital of the future, or the healthcare model of the future, is actually on demand wherever the patient wants to get his or her health care. So the hospitals will be smart hospitals. Hospitals will have to get connected with the patient, whether the patient is at home, at work, or coming to the hospital setting. Right now, what happens is a patient comes for diagnosis, a consultation, in a hospital setting, gets the treatment advice, and then 99% of the care is actually in the home setting, where the hospital is not directly playing a role. Two things are driving the change. One is the consumer behavior itself is changing. The second is, as practitioners, you would all know, hospital businesses are under a lot of pressure. And a significant part of the patient's healthcare value is actually at the home setting. So how can hospitals build the bridge where they connect with the patient once the patient is at the home setting, both for provision of care and delivery of services? That's where startups are kind of playing the role of the bridge. And I think the smart hospital concept will be, actually it will make a hospital closer to the patient. A patient sitting at home, a patient in a conference, a patient traveling will feel, I can engage with my hospital right here, right now, and I would go to the physical location when a physical examination is required, when a surgery is required, when a radiology test is required. Whatever can be screened at home, whatever follow-ups can be done at home, they actually will be done more and more at home. So the hospitals will be leaner, hospitals will be more engaged with the patients, and they will actually address a broader base of patients for a much longer duration. Now, how do hospitals prepare for this kind of a future, and what all is actually happening in the ecosystem as we speak? So I deal with a lot of hospitals, and they all struggle with what to do with the change in technology and which startups can they and should they engage with. There are a few very obvious questions in mind. Um, One big question people have in mind is the security of their customer base, and dealing with a startup, how does that look? The other big question um, is this an activity that is so important that we have to do it ourselves? And then are we enabled to do that? Um, there is also a question of, will this startup survive? Or we'll get totally dependent on this and then this entity could die. And I think those are very valid questions. Um, One needs to figure out the right partnership models, and that is where I think both sides need to realize that there is no other way. We have to find ways to engage, because what is required in these digital technologies, it's never just an app, it's never just a website, it's an entire technology ecosystem if it is to work. And developing that, like platforms like ours do a new release every 15 days. Very often we think that it's an app, once it's made, we'll get it made from somewhere, then it'll serve us. The fact is the rate at which consumer technology changes, they become obsolete in 2 months. By the time you get your platform developed, it's an obsolete platform. And that's the nature at which technology works. Today, a company like Amazon still has more than 20,000 engineers working day and night to make the same add to cart happen. And why is that? Because the expectation of the consumer of technology they engage with keeps changing, and that's where focus is important. And that's something that a startup is much better enabled to do as their full-time job than probably a hospital trying to engage in that domain. So I think what we are seeing is the world is moving very fast, where consumers' expectations are a lot more of on-demand, real-time service for everything. And healthcare is very quickly moving into that zone. Now, one more very, very important thing that has actually gotten highlighted in the last 4 to 6 weeks with Corona, which is the thing on everybody's mind. And it's very, very important that we think of it, because it's not just about convenience, it's not just about demand, it's actually about safety. The China example, if any, has actually taught us some very important lessons. China had a very strong digital healthcare ecosystem built over the last 5, 6, 7 years, where the consumer, they created a concept called an internet hospital. A consumer could engage with healthcare from their home as normal behavior. Now, why is it important? For a contagious disease like Corona, or a condition like Corona, I should say, if a patient is feeling a little unwell, there are probably three things that can happen from there. That consumer goes to a hospital setting. The consumer, let's say, was not infected. Chances are high that the consumer will get infected after going to the hospital, just because the immunity is anyway low and they are exposed to a very viral situation and an ecosystem. That's one danger. The second is that if the patient is anyway infected, the entire transport to the hospital and then the infection that gets spread in the hospital is a big challenge. The third very, very important big challenge is the healthcare workers, the doctors, nurses, and healthcare workers who are dealing with a lot of these patients. When SARS happened across the world, 21% of the infected people were the healthcare workers. It was the doctors, the nurses, the healthcare attendants. Now, the right model really is that the first screen should happen as much as possible digitally. Identify whether a patient could be treated without exposing himself or the health workers to actually a condition or situation where he or she could be at risk if that person can be addressed remotely at the first screening level. Then if identified as a risk, the quarantine and secluded movement to the hospital should happen in a secure manner. So that's how this model fundamentally should work. Just today, there was an article from National Journal of from England, NJEM, on telemedicine being the pillar on which a lot of the contagious diseases will be dealt with. And I say it is not just a luxury, it's a time of importance, a matter of importance. We cannot afford, certainly in India, if 20-30% of the infected happen to be healthcare workers, we are in a massive disaster situation. And we need to embrace these technologies, not because it's no longer a choice, I would say. It's the way the world has to move because it's a better model. And technology always has to be a support and a medium to give better healthcare to the consumer. And that is extremely important. So the way these engagements need to be structured, the way they need to be worked, has to be a long-term thought process, has to be a strategic engagement. And I would just urge everybody here to be cognizant of the fact that sooner rather than later, one will have to move to a world where patient will engage real time, wherever he or she is, whenever he or she wants it. With that, I think my time is up. Thank you for your listening. Thank you.